So these clips have the power to evoke very strong feelings and memories in us, and that's the power of stories. So I want to ask the panelists now to talk about these clips and what they evoke for them. And I'm sure that you will have some shared feelings as well.
So I lost my girlfriend. She was 22 years old in 2003. Her name was Laura Rothenberg. She had a double lung transplant. She died of cystic fibrosis. But in the 20 months after her double lung transplant at Boston Children's, she had nearly 50 surgeries post-operatively. So needless to say, it wasn't a successful transplant from a medical standpoint. And we went through all of that, and all the way through, I went as a caregiver through the end of it. And it was painful. And there were certainly moments where I didn't know if I had the resolve to make it through. But afterwards, because she died the end of her life was similar to Christopher Plummer's character. Christopher Plummer's character at the end of in this film sees death as an opportunity to live the life he never lived, to come out of the closet, to be who he was, to make meaning out of the end of his life. And I became an evangelist after Laura died for getting people to talk about and acknowledge the possibility that death presents this radical opportunity to make meaning. It doesn't happen for everyone, but if we pay attention to it and we're there and we're present, we can have this profound experience, very similar to birth. I had my first child 2 years ago, and it was the only thing I could, that I could compare. This moment of being present and being with someone and with my family and having it be so significant. And most people don't have that experience when they die. So wherever we fall on the spectrum of politics and policy around end of life, I would just like to hope that we, as a culture, we could come to a point where we could agree that we should be delivering the same amount of resources and energy toward creating meaning around death that we do to birth, which over the last 30 or 40 years has become quite an industry. That's some of the things that brought up in me. It actually makes me joyful to think about what we accomplished in 5 months. We lived lifetimes. And, it was precisely when we stopped treatment that her life really began. And, you see that in the film, and I'm touched by it. And if there's anything that I would like to see people talking about, it's that. It's that particular phenomenon.
So your life really was taking the template of your life, so to speak, to this film, helped you kind of think through things again or inspired you to think things through again and articulate them, and you shared them with this audience, and that's really a step in the direction of talking about end of life, that it motivated you to do this. You didn't feel alone. You're part of a community because you're seeing this and now you're sharing it. So stories can be so evocative in this way. It can start this conversation that is a conversation that we haven't maybe been having enough. How did it make you feel when you saw it, and what did it, because you have very different experiences as a physician and working in palliative care.
Mm-hmm. Well, again, I think very much as Bryan has said, I think it wonderfully models the opportunity to die well. And as patients will often say to me, I've never died before. How do I do this? And then, like typical Americans, they start reading books about how to die well. And so this is, modeling dying well, in a sense. This extraordinary, so the opportunity for him to live his life after having led a sort of secretive life up to then, and the opportunity to have all of these friends be a part of that experience and to be open to that experience. And as you see, the medical community is unimportant to this man. I mean, they were there and they were in this background, and I wouldn't want to definitely model their behaviors. However, they were not important, because what was important to him was that he knew that he was dying, he was told he was dying, he had gotten some treatment. But the important thing was the meaning that he found in this experience. And so I think that's so powerful. But also what's so powerful about this film is you see the extraordinary loneliness of the caregiver. the son who is struggling to take care of him and who is somewhat isolated and trying to understand his father and understand his father's death and then understand how to provide this care. And the extraordinary burden and process and the enormous need we have as a society to support that caregiver. Because how that caregiver sees his father die will influence how he chooses to die and the kind of care that he uses. So it's so powerful. And there's every bit of data that if your family member then dies well in your care, then you will do well in your grief and in your bereavement. So this is not just the health or the care of the person dying, it's that those who survive this. So I think that so the film brings out many of those different issues.
So it's so rich in that, and stunning in that we can have different kinds of feelings bringing our own experience to it, but
right.
It's a shared feelings too, because I saw people nodding when Dr. Foley was saying the loneliness of the caregiver. I saw people go, So there's that connection. I saw people nod when you talked about liberation. It was liberating for Christopher Plummer's character. And when Bryan spoke about there was joy, it was learning to live in the moment. I saw a few nods again. So you all have had disparate kinds of experiences, but they still connect to this film, and that's what is so incredible about the arts and that how we can
Their
use
ability
them.
to do that.
Yes, well, the entire community that surrounds him in these final 4 years of his life is what was so striking to me. As a son who has watched his father die, I was so struck by really the narrative point of view of the film is from the son. And you already spoke of his loneliness. I was touched by the mechanics of death, the emptying the medicines, cleaning out the closets, paying the bills, and how painful that is, how soul-wearying it can be to have to deal with these possessions, many of which you have are just soaked with memories of your father, of your loved one, and to put them away. So that the film captures how mundane the life, not just the loneliness, but the quotidian experience of just slogging on through, even though you feel empty inside.
Well, that's certainly, for me, just seeing all the checks and the paperwork, because when my father passed away 2 years ago, there were just mountains of paperwork. Mountains and mountains, and it was a way of getting through it. And so that took me back to that moment 2 years ago in August. So it's really just, it's so profound what drama can do. Drama can show so many points of view and perspectives that an article or those numbers I gave you before. Now if I told you that number again, that half a $1 trillion is spent in the last year of life, and we've seen these artistic presentations, it might make more sense to us when we would say, wow, maybe that's a lot of money to be spending. Maybe we're not thinking about this in the right way. It gives the numbers a context. It gives us a way through these stories of starting to think about these issues in a way that maybe we hadn't thought about before, and the fact that we keep wanting to live because we've talked about being afraid, the grief, wanting our loved ones to stay alive, and we're spending a lot of money doing that. To what end? And we're giving new models in this film that you just saw of thinking about end of life. But certainly television and movies aren't the only way. And so there are other ways that are very much in the present. And so Bryan is going to now do a theatrical presentation to really give us another perspective and way of telling stories about the end of life.